Hello, my name is Nikita James and this is my week 6 medical terminology pronunciation video. Number 1. Hysterosalpingo-oophorectomy. Hysterosalpingo-oophorectomy means surgical removal of one or both ovaries and oviducts along with the uterus, performed commonly to treat malignant neoplastic disease of the reproductive tract and chronic endometriosis. I don't think I've ever met anyone that underwent a hysterosalpingo-oophorectomy. Endometriosis. Endometriosis means an abnormal gynecologic condition characterized by ectopic growth and function of endometrial tissues. In more severe endometriosis cases, surgery may be required. Orchidectomy. Orchidectomy means surgical removal of one or both testes. The patient underwent orchidectomy a few days ago. Pyelonephritis. Pyelonephritis means a diffuse pyogenic infection of the pelvis and parenchyma of the kidney. Kelly was diagnosed with pyelonephritis and is due for her surgery next week. Cholelithiasis. Cholelithiasis means the presence of gallstones in the gallbladder. It is very interesting to read about cholelithiasis and how it happens. Erythrocytosis. Erythrocytosis means an abnormal increase in the number of circulating red cells. Can anyone be diagnosed with erythrocytosis, and if so, does it usually happen at a certain age group? Leukocytopenia. Leukocytopenia means reduction of the number of leukocytes in the blood. My doctor said he has treated at least 2 people with leukocytopenia so far in his career. Melanoma. Melanoma means any of a group of malignant neoplasm that originate in the skin and that are composed of melanocytes. Research is an ongoing process in finding new ways to treat melanoma. Xanthemia. Xanthemia means the presence of yellow coloring matter in the blood. Jaundice is a very good example of xanthemia. Sonographer. Sonographer means an allied health professional with special training in the use of ultrasound equipment for diagnostic and therapeutic purposes. I think being a sonographer would be a very difficult but interesting job. Hyperemesis. Hyperemesis means excessive vomiting. My sister had hyperemesis while she was pregnant with her daughter. Antitumorigenic. Antitumorigenic means opposing tumorigenesis, serving to counteract the formation of tumors. I know of someone that had to take antitumorigenic medication. Cerebrovascular. Cerebrovascular means pertaining to the vascular system and blood supply of the brain. I believe any dysfunction of the cerebrovascular would cause speech and sight problems. Encephalomeningitis. Encephalomeningitis means an inflammation of the brain and meningitis. It's very sad when children die from diseases such as encephalomeningitis. Metastasis. Metastasis means an active process by which tumor cells move from the primary location of a cancer by severing connection from the original cell group and establishing remote colonies. Joni was informed by her doctor that her cancer had spread due to metastasis. Morphology. Morphology means the study of physical shape and size of a specimen, plant or animal. I've never heard of morphology before until I took medical terminology. Dermatome. Dermatome means the mesodermal layer in the early developing embryo that gives rise to the dermal layer of the skin. Is there any way that dermatome can get infected? Hypodermic. Hypodermic means pertaining to the area below the skin, such as an hypodermic injection. I received 2 hypodermic shots prior to my deployment. Ureterocystostomy. Ureterocystostomy means surgical transplantation of the uterus to a new site in the bladder. I don't know much about ureterocystostomy, but I wonder if there are any side effects after the surgery. Epididymitis. Epididymitis means an acute or chronic inflammation of the epididymitis Due to epididymitis, John had to have surgery. Thank you.